I'm going to do something unusual since we haven't had a COVID update for a while. We normally can't respond to public discussion, but then bring Andrew up to kind of give out a little bit of what's going on and kind of keep it short. But Andrew's in charge of our public health. And there's a lot of people saying fingers are pointing. There's a state mandate for students to wear masks, but they give the option for the school districts to enforce it. And then the school district boards are pointing back to the county. And I can see how everyone gets very frustrated with all this. So I wanted to kind of make that clear. And Andrew, what is the situation here?
Sure. Good afternoon, Mr. Chair, members of the board. Andrew Gofrak, Interim Director for Public Health. So the way that the CDC and CDPH have outlined the guidance and the recommendations is that there are 15 different levels of guidance for masking and other precautions relating to safe back to school. The CDC, and I'm going to read the language directly, is that schools will have a mixed population of both people who are fully vaccinated and people who are not fully vaccinated. These variations require K through 12 administrators to make decisions about the use of COVID-19 precaution strategies in their schools to protect people who are not fully vaccinated. The enforcement is up to the schools. However, masking is one of those that is still under the state health order for K through 12 indoor setting where students are present. Sorry, go ahead.
So I just want to just restate in English. So the CDC has recommendations. The state public health order still says students have to wear a mask.
Correct.
And I have a lot of people come and talk to me. It's like, well, why don't you just make your own rules? The county cannot make a less restrictive rule. We can make rules more restrictive, but not less restrictive. All we have a chance to do is what level of enforcement that we do on a more restricted rule or law. Kind of think of yourself as law enforcement. If you wear your seatbelt, that's a state law. When that law enforcement pulls you over and writes you a ticket for not wearing a seatbelt, that's up to that law enforcement person. You're still violating a code if you're not wearing that seatbelt. That's kind of what we've been put in position for as the board and in public health for the last 18 months. How much enforcement of the state public health order are we going to do? Andrew, how many citations and fines has public health given out the last 18 months?
0.
So 0. So we're probably on the low end of enforcement. So as you go talk to school boards, and I will be sympathetic, I have a 13-year-old going back to school as well. I actually got her vaccinated, but I don't want her to wear a mask either. Now, we have only so much we can do on a local level. Like I said, we cannot as a board make rules less restricted than what the state public health is. All we have the opportunity is what to enforce and what levels of enforcement. And the school districts, I've heard this many times, are pointing the finger at public health because what they have to do is they have to take the state public health order and regurgitate it. And we can make it more restrictive, but we have never made it more restricted. We've done painstakingly to make it as least restricted to the state as possible. And the only thing we have to do on the county level is what level of enforcement. I guess that's about it. Do you have anything else to add? Anything else coming down the pike on this since I got you up here?
As far as school guidance, nothing additional other than what's already out there, but we will say that the transmission rate is drastically increasing since June 15th. Today's numbers, case rates per 100,000 is 10.7, which if we were to have still had the blueprint for economy, we'd be in the purple tier.
Thank you. So things are going back up since we've been open, which is expected, especially after 4th of July gatherings and things like that as well. I also will say for those who say, why don't you take more proactive, we have taken the governor to court, up to the California Supreme Court, and we lost. We have challenged many of those orders at the beginning of this, and many other entities have as well. We have made resolutions in the past as well. It still doesn't change the fact that we have to regurgitate the state public health order, and we have the sole level to enforce or not enforce those state rules. And we've done a educate-only approach to even during the highest levels of the pandemic through the county when we knew businesses were not following the rules. And we have sent them letters, but we've never fined anybody. We never physically went out and shut anybody down. We never sent law enforcement out anywhere. And we continue to try to be very open with our residents as far as education, encourage them to take their level of comfort of safety measures they do for themselves and their family. And that's what we'll continue to do here on the county level. Yeah, please.
Can you clarify for me? I thought that the schools had the responsibility of whether they chose to enforce or not enforce.
That is correct. So they own the enforcement aspect.
Okay, because Christy, I'm with you 100%. All of our speakers today, I wouldn't want my kids wearing masks in school, and it's my choice as a parent. So that's a school board decision, whether they enforce or not at the various schools. Is that correct, within the districts?
That's
and
correct.
The county doesn't have a rule.
No, we act more in an advisement aspect, but it is up to the school districts to create their enforcement.
Okay, thank you.
And if I could, Chairman, the county does not have a health order in play that requires masking. So that's not something that's coming from the county side.
And unfortunately, as the parents run around and try to find out who to advocate to, they're being pointed all different directions. And it's very frustrating. And we will continue to work. We do meet. I have met personally with some groups on the outside to see what we could do to advocate more and to educate more on this issue. The state's kind of, well, let's call it what it is. They try to divert. The state is running the health order right now. The governor and his health advisors made the state cover order, but instead of taking responsibility, they now pointed down to the school districts and said, you guys have to enforce. Or not enforce, is up to you. But in reality, they get funded and mandated by the state to follow these rules. So it's really a bad situation for the local school board members too, where they said, well, it's up to you to enforce, but by the way, we're the one grading you, guiding you. The county doesn't. It's the state. State funds our schools directly. They set the rules for the schools. And then the school board members don't know what to do besides point to the county public health order because that's what they see on the each by county. All we're doing, and that's not true for every county. The LA County is much more restrictive. You see that in the news where they say you got to wear a mask indoors. You can make it more restrictive. You just can't make it less restrictive. And we did, those entire time has made it as least restrictive to the state rules as possible. And then we have our choice of level of enforcement. So thank you, Andrew. I just want to bring that up and understand everyone's frustration, though. I really do.